laptop to the TV room? Yeah. Because it'll just be easier because I just take it home with me. Yeah. Because I can pull charts and make sure that it makes sense. So I'll just keep this. Yeah. Okay.
So is it working? Out there. Yeah. Got it. Should advance. Down and then go back. Try to grab the numbers.
Okay, good afternoon. Happy Valentine's Day. My name is Jeremy Adler. I am the Tippecanoe County Health Officer. I'd like to welcome you to our quarterly Gateway to Hope Community Forum. The purpose of this forum is to share updated data about the Health Department's Gateway to Hope Syringe Service Program and allow an opportunity for questions to be answered. I'm going to use the microphone so that our members of the media can hear me, so I don't have to shout, even though there's only a few people here today. For those of you who are not familiar with Gateway to Hope, it is our it's here. Yep. Thank you. Gateway to Hope is the County Health Department's syringe service program. This is a harm reduction program that we started in August of 2017 as part of an evidence-based response to a local public health emergency due to rising hepatitis C infections in our community. These hepatitis C infections were increasing because of injectable drug use and the sharing of needles. The goals of Gateway to Hope are to reduce the number of new cases of hepatitis C in Tippecanoe County, prevent an HIV outbreak in Tippecanoe County, provide safe disposal of syringes, and importantly serve as a path to treatment by linking participants to drug treatment, healthcare, and social services. Currently our program operates out of 3 locations. One is the Tippecanoe County Health Department office on 6th Street. The other 2 sites are sites for our mobile unit. One is at the Lincoln Center on Salem and 14th Streets, and the other is at the IU RNN Clinic at 2600 Greenbush. Later this year, we will be moving our program to the Lafayette Transitional Housing Center that is currently under construction at Union and 12th Streets. That move should occur sometime this fall. And we are also happy to report that we'll be purchasing a new, larger mobile unit that will be available hopefully later this year, probably in the fall or early winter. This slide contains a lot of data, and I'll walk everyone through these numbers. These are the syringe distribution and collection numbers, cumulative totals from the program's beginning, which is August 11th of 2017, through the end of 2018, December 31st of 2018. We've had a total of 363 participants over that time period. In blue, you can see the total number of syringes that we have distributed, 49,685. And that number is broken down below to the number given to new participants at the first visit, and then those given to returning participants. When participants return, they turn in their dirty syringes and exchange them for clean ones. The next column over in red is the total number of syringes collected from August 11th of 2017 through December 31st of 2018. That number is 76,566. And below that, that's broken down into syringes collected as part of the program, 39,146. And then syringes collected as part of our community drop-off. One of the goals of the program is to provide for safe disposal of dirty syringes, and so we are a site for anybody in the community to drop off dirty needles and syringes. And amazingly, we've had almost 40,000 dirty syringes turned in. These were not syringes that originated from our program. These syringes were from other sources, so they have been safely disposed of and protecting our sanitation workers and public in general. At the bottom of the screen, we have two figures, one in gold and one in red, and these are different calculations of the return rate of syringes for the program. The first number in gold simply takes the number of syringes collected as part of the program, so 39,146, and divides it by the total number of syringes given out, which is 49,685. And that is 78.8%, which, as you can see from the string of numbers after it, is an improvement from where that percentage was at the beginning of the program. One thing to consider when looking at that figure is that it includes syringes that were distributed to new participants at their very first visit. At that visit, most participants don't bring in syringes at all. If they do, it's a very small number. In fact, you can see over here the total number of syringes collected at the first visit from all participants over this time period was only 1,996, because many people perhaps have been using the same syringe over and over again for many weeks or many months, or sharing it with other people, so they don't come to the program with very many, so we give them some to get them started out. And also, this 78.8% figure includes the number of syringes that are given out at the end of the reporting period for ongoing harm reduction. In other words, our reporting period for this slide ended on December 31st, and so during that week, people came in, they brought in their dirty syringes, they exchanged them for new syringes. Those new syringes were given out, but as of December 31st, they had not yet been returned. They probably will return the next week or the week after, so that figure includes those two. Below that, we have a different calculation of return rate, and this is the calculation that the Indiana State Department of Health uses for syringe exchange programs. And this basically just takes into consideration the syringes that are collected from returning participants and dividing it by the number of syringes given out to returning participants, so taking out the new participants from the equation. And you can see that that figure is 95.6%, also has increased gradually from the beginning of the program, has dipped a little bit in the last 6 months or so, but is still quite high. The state average for syringe exchange programs for this figure is 80%, so our program is well above the state average. So we think that whichever calculation one chooses to use, that our program has a very favorable return rate for syringes. As I mentioned earlier, one of the very important aspects of this program is providing linkages to other vital healthcare, drug treatment, and social services, and we provide many of those as part of Gateway to Hope. One of those is testing for hepatitis C and HIV. We're proud to report that 84% of our participants have been tested for hepatitis C and 82% have been tested for HIV. So this is a very important part of the program. In addition, we provide many other valuable services, including substance abuse treatment referrals, substance abuse recovery. We are very fortunate to have a substance abuse recovery coach on site at our program to provide counseling and recovery services. We also provide referrals to mental health services, Narcan, testing for sexually transmitted diseases, insurance navigation, immunizations, housing and food assistance, and safe injection handbook. You can see for several of these we have provided these services hundreds of times. So we're very proud that our program has been able to also provide these important services, and that we're not just simply a needle exchange. We are trying to approach this problem from a much broader standpoint. Another aspect of our program has been a community cleanup, where we have a team of volunteers who each week go out to various neighborhoods looking for dirty syringes and collecting those for safe disposal. Between August 11th of 2017 and December 31st of 2018, they've only found 9 dirty syringes. However, they have been able to collect 83 bags of garbage. So this aspect of the program will definitely continue, and we hope that that will help keep our neighborhoods clean and, of course, safely dispose of any dirty syringes that happen to be found. This next slide is a very important slide. The primary goal of our program, of course, has been to prevent or reduce new cases of hepatitis C in Tippecanoe County. And so this slide shows the numbers of new cases of hepatitis C in our county dating back to 2011. And you can see between 2013 and 2016 and into 2017, there was a very steep increase in the number of new cases of hepatitis C. And this increase was what led to the formation of this program and its approval in late 2016, and then its start in 2017. And we're very happy to report that so far, preliminary data for 2018 shows a much lower number of new cases of hepatitis C than we had in 2017. 122 for 2018 versus 176 in 2017. So 54 fewer cases, a 30% reduction in hepatitis C cases. Now this data here for 2018 is still considered to be preliminary because the final counts probably won't be available until March or April. There tends to be a little bit of a lag time in epidemiology and the data. And so during our next quarterly community forum, which will probably be in late April, early May, we should have more of a final number for our hepatitis C numbers for 2018. But unless something unexpected occurs, I would guess that it will remain far lower than it was in 2017. So we think this is a very good indication that our program is making a difference and is helping to prevent new cases of hepatitis C in our county. One of the other goals of our program has been to prevent an HIV outbreak in our county. In many communities with this problem, hepatitis C outbreaks often are a warning sign that an HIV outbreak is coming shortly. That was the case in Scott County, Indiana, down in southern Indiana. And so in our county, we wanted to get our program going before we had an HIV outbreak. And so one of our goals has been to keep our HIV new cases low in our county. And you can see here, again, dating back to 2011, our program started in 2017, and preliminary number for 2018, 8 new cases of HIV, same as 2017. So we've not seen a spike in HIV cases, which we consider to be a sign of success, that we've prevented an increase in new HIV cases in our county. So just to recap, the goals of our program have been to reduce new cases of hepatitis C in Tippecanoe County, prevent an HIV outbreak in Tippecanoe County, provide safe disposal of syringes, and serve as a path to treatment by linking participants to drug treatment, healthcare, and social services. And we feel that our program really is on good footing and on track to accomplishing all of these goals. We're pleased that the county commissioners were able to provide us with a 2-year renewal for our program in December of 2018. So I think that is also a testament to the fact that our program does seem to be working and is accomplishing the goals that it set out to accomplish. Each time we do this, I always like to include some quote from an expert or a journal or a magazine about syringe exchange in general. And this quote came from a very good article about syringe exchange programs that appeared in The Atlantic in 2012. Search exchanges are internationally credited with dramatically reducing HIV and hepatitis infections among injection drug users. They've also been proven to link addicted people to care, save taxpayers millions of dollars in healthcare costs, and help keep syringes off the streets, protecting both cops and kids. And so we think that we are seeing all of these benefits here in our county, and we believe that our program will continue to provide these benefits for our community. I'd be happy to take any questions at this time.
I'd just like to thank you all for what you do.
You're welcome. Kayla or Amanda, did you have any comments?
I mean, just to touch on the new mobile unit that we will be getting. It'll be here, we should be ordering it this week or next week. They told us our build out would be 270 days, so we should see that around there. And obviously we will be able to go out of Lafayette Transitional Housing, but we will be in their parking lot with our mobile unit also. The mobile unit will be able to be used for back to school clinics, STD clinics. We can use it for a variety of different things, so we're really excited about that.
Also, the reason it's only 82% for Hep C or HIV is because if you come into the program, we already know your status. If you already know you're an HIV positive, we don't need to test you for HIV. So that's not included into that total. We do have several HIV positive participants, just like we have several Hep C positive who've already had confirmatory testing. So that number doesn't add up. There's like 18% that we haven't bothered testing. That's not accurate number.
That's a good point.
Yeah.
Thank you. Questions? Well, thank you very much for attending. Appreciate it.
That's the shortest one yet.